The office, number 3. Very interesting clinical vignette of a complicated patient. The man's a 47-year-old man. He has a history of diabetes, intermittently on insulin, HIV, and chronic venous thromboembolism on rivaroxaban. He also has a history of persistent hypercalcemia. I first met him about 4 years ago. His calcium was 16, and we couldn't find the cause. And we found that his vitamin D level, 125 dihydroxy D3, was elevated. It was sky high. He did not have sarcoid or any granulomatous disease. Okay, this was due to silicone injections in his buttocks. And he couldn't have them removed. He went to plastic surgery. There's nothing we could do. And since then, he's been suffering with intermittent hypercalcemia. And as expected, the only treatment for this is prednisone. He goes on prednisone, the calcium goes down, his blood sugar goes up. Sometimes he needs insulin, and he has all the other complications of chronic steroids, osteoporosis, potential adrenal suppression, and even risk for PJP pneumonia if he's on greater than 20 milligrams a month. So what do? This keeps going on. He's had multiple kidney stones and urologic procedures, and this really seemed like a problem without a solution because you couldn't get him off prednisone. This is the point. There's an alternative. Hydroxychloroquine. This drug could be used in certain instances of hypercalcemia that involve increased 125 dihydroxy vitamin D, the granulomatous diseases. So someone with sarcoid who has hypercalcemia, or theoretically any other granulomatous fungal disease, you could potentially treat them with hydroxychloroquine. And that's what this man, because his granuloma is induced by silicon, that's how he's going to be treated. His calcium's coming down and we're lowering his steroid dose. This is an interesting vignette. If he had hypercalcemia due to cancer or due to primary hyperparathyroidism or due to any other cause, this would not work. But hydroxychloroquine, I'll write it again, has a small role in hypercalcemia due to elevated 125 dihydroxy vitamin D levels. It should be noted sometimes lymphomas could cause hypercalcemia via this mechanism. It doesn't work for that group of patients, but for this guy it seems to be working. And that's the point of the day in the office. Thank you.